occupational therapy, so I get to take you through the next section of your presentation. One of the main things that I do is to help you with safety in the bathroom, getting your home ready, things that you can do, helping you get prepared beforehand and stuff, so that when you get home you have less to worry about while you're healing and you're still up and moving and following your precautions and as safe as you can be. So we'll start off with some little home tips. One of the things you want to think about is in the main rooms that you're going to be in, you want to remove any tripping hazards. And what I mainly mean by that is, like, if you have throw rugs or cords that might get in the way, ideally we like to be able to roll those throw rugs up and put them aside for a couple weeks. But if not, if for some reason the floor underneath is more slippery, you can leave the throw rug down and just put duct tape on all four sides of it all around. With your cords, put a piece of duct tape on it, because that does two things. One thing, does affix it to the floor, and that gives you a visual to be aware so that you don't trip, because those are easy to trip over. They just jump out in front of you all the time. So those are one of the things. And then also, if you think about the areas you're going to be in, you don't want anything that you're going to have to be using your walker or your cane. You don't have to be lifting stuff over, trying to get it, reaching, doing all these different directions and that kind of stuff. So anytime you can pull any of those things out of the way, that'll be ideal. Non-moving chairs, think about the chair you'll be spending the most time in after your surgery. You want something with good support, good back support like the ones you're sitting in now, something with some arms push up. What you'll notice after we see you after your surgery is that you're going to be doing a lot of what we call from sit to stand, and we're going to have you pushing up off of the surface. So you want something with that good support. Okay. Arranging drawers and cabinets. The biggest thing here with the precautions that you have is that you can't go any higher than the top of your head. So your safe zone is going to be, you can reach to the top of the head and just under your belly button. So that's kind of your safe area there. So in the kitchen, for example, move a couple sets of your dishes down on a lower shelf in the cabinets. Anytime that you can, slide items instead of trying to pick them up to move them. In your bedroom, thinking about the clothes that you're going to be wearing, of course, you're going to want to wear your comfortable stuff that's relaxing and fits nice. And so you can use the reacher, which I'll show you. Lots of different uses for the reacher, but one of them, opening up your drawer. You can reach down and get your clothes out of it, so you're not to avoid that bending that you don't want to be doing for those precautions. We'll go over that a little further into the presentation. Bathroom needs, we're going to cover that a little bit further too. Have some techniques I want to show you for that. Thinking about the shoes you're going to wear, you want to wear shoes that have some good solid support. You want to avoid flip-flops, anything with heels. If you're going to be wearing tennis shoes or something with some kind of a string, you have a couple different options. They do have elastic shoelaces, so you can just they look just like your normal shoelaces. You tie them up, and then you can use the reacher, get hold of the tongue, and pull up the tongue, and then put your foot in there, and then when you let go, the elastic kind of shuts it, so you're not having to worry about trying to tie them. Because with those limitations, you're not going to be able to, bend down like this to get to. You're not going to be able to get down the fit that way. And if you are going to wear your normal shoe, or if you want to just continue with your normal shoelaces, just tie them a little bit looser. That way, you can again use the reacher to hold onto the shoe to put the foot in, and then when you put it on, it'll be tight enough. For any of you that have pets at home, the main thing you want to think about is that with those limitations of no bending and no lifting and twisting, you might want to use a pitcher. Put the water in the pitcher to pour it into the bowl. Have somebody else take care of it as much as you can. Or for their food, you can divide them into Ziploc bags, however much you give them per feeding, and then you can just open them and dump them into their dish. If you are going to be the one doing them, feeding them by yourself, you want to put them on some kind of, put their bowls or whatever on some kind of a thing to raise them up a little bit, just to prevent that bending there. Meal planning, we'll talk about that in a minute as well. Enlisting a coach, mainly that is just knowing who you're going to have to pick you up from the hospital, who's going to take you to do your shopping or go do your shopping with you, because you won't be able to drive for the first couple of weeks. Do the pain medications and that kind of stuff that you're on. If you have any further questions about that kind of stuff, just write them down, and when I see you one-on-one, you can ask me about those. I'll be happy to answer those for you. Next section we're going to go over is a little bit of what we call our durable medical equipment. In your books, there's a sheet that has a group that we lend equipment out for. So these people are really great. You call them and let them know what piece of the day you're having your surgery, what you need to borrow, and they'll set those out for you. Tell them go ahead and come and pick them up, and then use them for as long as you need them, and then you just get to return them. So we're going to go over those really quick. So the one thing you want to think about is for those of you that have maybe the higher toilets at home, a toilet rails is something you'll need for those higher toilets, because you're not going to be able to do that pushing. You're not going to be able to pull yourself up on a cabinet or use a bar, any of that kind of stuff. You're not going to be able to do any of that pulling to help you get off of the toilet. Again, remember I said this is kind of your safe zone, is being kind of the straight up and down. Those of you that have a lower or normal height of toilets, you want a toilet seat riser. This is a good thing to write down on that list so that you'll know what the name of it is when you call. The toilet seat riser is really great. This is most likely the kind that they'll lend out. It has the amount of lip that you need here, and then it has the handles to push up off of. And it's really easy. It doesn't require any tools. You just attach it right on to the base of the toilet there. So the toilet seat riser. If you happen to call and they tell you we don't have any toilet seat risers available, but they have a 3-in-1 commode. That will work just fine. This is what the 3-in-1 commode looks like. These are good too because they are adjustable. They just go right over the toilet. You could also use them for the shower chair if you need to. So just know that there's other alternatives that they'll work with you best they can. Those of you that have walk-in showers, you can put your shower chair just like right in the back of there, so you can just step into the shower, back up to it, and sit down. Those of you who have that maybe shower bathtub combos, this will work for that as well. Again, you'll just put it in the back of the bathtub area there, so you can sit down on it. It is adjustable, so you can adjust it height-wise if you need it. One of the good things about it is that because it goes right in the bathtub, when you're stepping in your bathtub, say to the right here, you can hold on just to the wall, and you can just step into it, back down to it, and then you can sit down in it. Excuse me. Another thing you're going to want to think about is that while you're sitting down, you're going to want to have some kind of a long handle sponge. When you're sitting down, since you can't, bend down, the long handle sponge helps so that you can wash your feet and that kind of stuff without doing any of that twisting and bending, those things that you're not supposed to be doing. This type is a really easy one. You can get them, at Walgreens, Walmart, any of those kind of stuff. They think with a long handle and a loofah or something at the end while you're sitting down. That way you can, wash all the different areas without having to do any of the bending and the twisting, that kind of stuff. Also think about where you're going to keep your body wash and shampoo, because you're not going to be able to bend down to get those things. So if you want to be able to put the bathtub shower combo, maybe put them on the side of the bathtub here, up in the shower. There's usually a ledge and that range that you can put them up on. Another thing is having the reacher close by. So if you do have to put them on the shower floor or whatever, you can use the reacher to get a hold of those. Now the dressing. As you can imagine, when you have limitations such as bending, lifting, and twisting, getting dressed is going to be challenging. So I'm going to go over a couple of pieces of equipment that'll make that a lot easier for you. I'd mentioned the reacher a little bit earlier in the video. The reacher is a really great piece of equipment after surgery such as what you're having. It just works as an extension to your hand. I had mentioned how you can use it to open up drawers, to take your clothing out of the bottom drawers. You can use it to take stuff out of a dirty clothes basket, pick it up to put it in the washer, take things out of the washer and put them in the dryer. It's just a really helpful piece of equipment when you have a limitation bending, which is one of those things that you never realize how much you do it until you can't do it, and you'll notice that you'll use it quite a bit. Another way you can use this reacher I'm going to show you is for dressing. There's a couple of different options that you have with this, but I'm going to just kind of go over. There's 3 different levels. So you start off by putting the garment across your lap. Those of you who are having neck or having cervical surgery or neck surgery, you can just start off by putting the garment over your lap, and usually all the help you need is from right here. But you got to remember, you're not going to be able to look down, so you have to do a lot by feel. So you may not need the reacher, but you can drop it down like this, put one foot in the other, do it by feel, put the other foot in, and then pull it up just as normal. Those of you having the below the neck and a little bit lower, again, you'll start off by putting the garment across your lap. There's a couple of different lengths you can do here. Some of you might just need this this much help. So you just getting a hold of it, and you put your foot in there, keep everything nice and straight, pulling it up. If the garment tends to get caught, it's going to get caught around the toes and the heel. Just use that reacher and just grab a hold of it to pull it up. The other thing, there may be some of you, those of you having the lower part of your back done, it gets a little more difficult. You may have to actually drop the garments to the ground. So again, you'll start off by just putting it across your lap, and then lowering it down here. Again, the reacher does all the work for you. You're just keeping everything nice and straight. Drop it open, put both feet in there, and then you can grab the garment in the middle, pull it up, and then get hold of it with the other hand, and then again, like I said, use that reacher to pull over those areas. That might be, once it's over your feet, it shouldn't fall off. The other thing that we're going to go across is the sock aid. The sock aid is a really great piece of equipment. So it only has the one job, but it is great at what it does, so it's going to help you to put your socks on. So I'm going to give you a little example here really quick. A couple different ways that you can load the sock aid. I do it like this because it's easier for you guys to see. However you can, lock it between your knees if that's easier, or even just hold it with one hand and then put the sock on that way. Okay, so we'll start off by doing like this. Get a hold of your sock at the top. You're going to roll it down just a little bit. Now those of you with having your neck done, you're not going to be able to look down, so you're going to do this by feel, so using your fingers. Remember, you want it to go into this middle one right here. Okay, so once you get in there, and then get hold of it with the other 2 fingers and just push it right in. Okay, pull it up to the top. Got to make sure you get all 3 pieces in there. Okay, so we're going to go this way, like that, up to the top. And then you're going to have a lot of extra here, so you want to pull that up. Give yourself a little bit of what I call tippy toe room, which will make sense here in a minute. And then pull your slack out here, a little bit of your excess out here, okay? When you've got the socket ready to go, take one strap in each hand and drop it down there, and you're going to put that foot in there, and you're going to do what I call a tippy toe crawl. And what I mean by that is you're just kind of walking those toes forward, okay? So put that foot in there, roll the straps if you need to, tippy toe crawl to the end. Once your toes get to the end, you can just pull it straight if your calf and it comes on. Really, really easy, so great. You'll be happy that you have it because it'll be very, very useful for you. Another way that the reacher can come in handy is that for many of you, some of you will be able to just use your heel to pull the sock off, but some of you that will be a little more painful and hard to do because of stiffness and soreness. So I'm going to turn sideways just so you can see what I'm doing, but you can use the reacher to do that as well. So again, right here on this indentation of your heel, just get a hold of this sock, pull the reacher, and you're just going to close it off just like that. Comes off so easy. And then also if you wear shorter socks like what I happen to have on today, this little hook thing does really well with that. Okay, so with the shorter socks, again, right there on that indentation of the heel, you're going to go down, and then you're just going to flip them right off. Really easy, and you can use the reacher to pick it up so you're not, again, doing that lifting, that straining, and twisting, any of that kind of stuff. Another way that the reacher could come in handy is if you're wearing, sometimes with your shoes, when they fold down in the back, you can use the reacher to get a hold of them, hold in place, to put the foot in. There's lots of different ways that you can use that. Okay. As I'd mentioned earlier, there's some things in the kitchen that you might want to do a little bit differently. Thinking about loading the dishwasher. Unfortunately, for the first couple weeks, you won't be able to load the bottom of the dishwasher because even sitting down, you're still going to have too much bending and too much twisting, and so you won't be able to do that. However, you can still do the top of the dishwasher if you like to load the top. Getting things out of the refrigerator is another thing that people forget because, again, until you do it, you realize you're doing a lot of twisting until you can't do it. So opening up the refrigerator, and instead of, once you take your milk or juice out, instead of twisting to set it down, once you open the refrigerator, take your juice out, then shut the refrigerator, then just take that side step. You can set it right there on the cabinet, or if your cabinet happens to be off this way, same kind of a thing, and then you can just do it that way. This picture here to the right shows about how I had mentioned putting dishes down on that lower shelf. Will be really, really helpful for you. Will make things just easier. When you're sitting in your chair or whatever, this is another time when the reacher will come in handy to avoid that twisting. If you happen to drop your phone or the remote control, any of that kind of stuff, instead of having to have your helper come and grab it, you can use that reacher to get down and get it for you, and then you're still following your precautions. One of those times that straining comes in, one of those things that we don't really think about too much. You won't be able to bend down to get things out of a lower cabinet. So if you've got pans or something that you use, you want to put them up on the top of the cupboard as much as you can. And then sliding things will be, I had mentioned a little bit earlier, for example, if you're making something on the stove, put a hand towel off to the side and slide your pan or whatever off of the stove, so it'll make it a little bit easier. You're not trying to do any of that picking up, even something as light as water. All right, guys, just about done. We talked a little bit about, so if you, after your surgery, some of you will be using a walker, and if there are times that you're going to be home by yourself, you can tie a Walmart or an Albertsons bag on the walker, making your sandwich or soup, and that kind of stuff. Just use stuff that has a lid. So put your sandwich in, something with a lid, put that right in there, and then your drink, something with the lid, so you can put them in the bag, and then that way you can use the walker to move forward and still keep safe. So now the next thing, almost done, guys. So getting in and out of the car. For those of you that are going home in a lower car, there's a couple different options that you can do. Ask whoever's coming to pick you up to slide that seat backwards, okay? I'm sorry, slide it back a little ways. And then you can put a pillow on there, on the chair, on the seat if it's low. And then you can back up into, kind of like it's showing you here, back up into there, sit down. Remember, you can use the side of the door, something to hold on to sit down, and then just picking up one leg at a time, push off with the one that's on the ground, pick up here, and then that way you're not twisting to get yourself in there. If you're going home in an SUV, they're usually pretty easy. You can just back up into and kind of turn around without hurting yourself or twisting and that kind of stuff. However, if you're going home in something a little bit taller, that you have to step in to use a running board and that kind of stuff, as I had mentioned, you're not going to be able to do that pulling up type of a thing, so you'll need some kind of a stepping stool to get onto, such as this one. And then you can just step up into a back up, and then do the same kind of thing, sit down, push off with one, put it in, bring your whole body. That way you're not twisting at the back, you're kind of twisting at the hips instead, keeping everything nice and straight. Well, that's all I have for you guys today. Thank you so much. Again, my name is Lavon with Occupational Therapy, and can't wait to get the opportunity to work with you again.